Rocaltrol Capsule contains Calcitriol, which is a synthetic analogue of vitamin D. It is used in the treatment of calcium deficiencies in the body associated with hypocalcemia, a condition with low calcium levels in the blood, and hypoparathyroidism, when the parathyroid gland located in the neck does not produce enough of parathyroid hormone. Indications: Rocaltrol capsule is also used in the treatment of secondary hypothyroidism, overproduction of parathyroid hormone, renal osteodystrophy, skeletal abnormalities occurring in people with severe kidney problems, and postmenopausal osteoporosis, a bone condition causing weak and brittle bones that develops after menopause in women. Rocaltrol capsule helps in regulating the absorption of calcium in the body. How to use: the dose of Rocaltrol should be carefully adjusted for each patient according to the biological response so as to avoid hypocalcemia. The effectiveness of treatment depends in part on inadequate daily intake of calcium, which should be augmented by dietary changes or supplements if necessary. The capsule should be swallowed with a little water. Renal osteodystrophy: the initial daily dose is 0.25 micrograms of Rocaltrol. In patients with normal or only slightly reduced calcium levels, doses of 0.25 micrograms every other day are sufficient. If no satisfactory response in the biochemical parameters and clinical manifestations of the disease is observed within 2 to 4 weeks, the daily dosage may be increased by 0.25 micrograms at 2 to 4 weeks intervals. Most patients respond to between 0.5 micrograms and 1 micrograms daily. Postmenopausal osteoporosis: the recommended dose of Rocaltrol is 0.25 micrograms twice daily. Serum calcium and creatinine levels should be determined at 1, 3, and 6 months and at 6 monthly intervals thereafter. Contraindications: Rocaltrol is contraindicated in all diseases associated with hypocalcemia, in patients with evidence of metastatic calcification, in patients with known hypersensitivity to calcitriol or drugs of the same class and any of their constituent excipients, if there is evidence of vitamin D toxicity. Precautions: there is a close correlation between treatment with calcitriol and the development of hypocalcemia. All other vitamin D compounds and their derivatives, including proprietary compounds or foodstuffs, which may be fortified with vitamin D, should be withheld during treatment with Rocaltrol. An abrupt increase in calcium intake as a result of changes in diet, e.g. increased consumption of dietary products, or uncontrolled intake of calcium preparations may trigger hypocalcemia. Patients and their families should be advised that strict adherence to the prescribed diet is mandatory, and they should be instructed on how to recognize the symptoms of hypocalcemia. Rocaltrol capsules contain sorbitol. Patients with rare hereditary problems of fructose intolerance should not take Rocaltrol capsules. Side effects: Rocaltrol capsule may have side effects like headache, abdominal pain, increased calcium levels, dry mouth, nausea, etc. These side effects may subside over time. Consult a doctor if they persist or worsen. Avoid taking Rocaltrol capsule if you are allergic to it.